This is like so bad. I know. Where are you putting these pictures at? Where are you pictures going?
So I will ask you before I post anything of you, but these are on social media.
Okay.
You're like, I would like approval.
Good evening. We're going to get started in just a few minutes. If everyone who is in the vestibule will come into the sanctuary at this time. We're going to ask all of our panelists to come forward, have a seat at the front of the church. Again, good evening, everyone. We're going to get started at 6:15 promptly. If we can have everyone who is in the vestibule that would like to attend this session to come into the sanctuary at this time.
No. Are we talking about it? I did a hair flip. Have you ever been on a panel before? You look like you are a good public speaker. You just have that look about you.
I was just on one Friday.
Really? Yeah, this is my first one. And I'm the only one, so I'm from the child care center. They want us, I guess, to have like a different perspective. So I feel kind of like a little person up here with y'all big wigs.
To our Smart Start inclusive, we have, if someone can
My
locate
sister
Dr.
is
Finney
mainly
and
she's
Superintendent McManus,
the veteran.
that would be greatly
My background's like
appreciated.
HR, but I moved here to kind of do like the business side of things. So I can kind of speak towards like the funding, but that's pretty much me.
All of the mics on stage are live. ladies and gentlemen, and welcome to our town hall meeting on the state of early care and education in Forsyth County. I am Pastor Tambila Covington, your moderator for this evening. I am also Smart Starter Forsyth County Board Chair. We have an engaging session planned for you tonight with a powerhouse panel that will come before you tonight. We also want to thank Reverend Dr. Herbert Miller II and the Emmanuel Baptist Church family for providing us with this gracious space to accommodate you all in the audience and our panelists. Before we have the introduction of our panelists, we have a brief introductory video about Smart Start of Forsyth County. Do we have the video in queue? If not, just wave and we will begin with the introduction of our panelists, and we will take a look at the video after we have introduced our panelists. All right, well, we get the technical pieces together. Good evening again. We have for our panelists, our first panelist for this evening is Tricia McManus. She is the superintendent of the Winston Salem Forsyth County School Systems. Our panelist number 2, we have Dr. Lewis Finney Jr. He is the Chief Executive Officer of Smart Start of Forsyth County. We have for our third panelist, Tracy Ross. She is the Chief Executive Officer of Family Services of Forsyth County. Our fourth panelist is Sharita Sutton. She is the Assistant Public Health Director of Forsyth County Department of Public Health. For our fifth panelist, we have Chantel Williams. She is the Division Director, Social Services, Economic Services Department. For our sixth panelist, we have Aola Sims. She is the Executive Director of Enrich Kid Academy. And for our seventh panelist, we have Dr. Paula Wilkins. If you will, let us put our hands together for our panelists on this evening. If we are prepared for the video, we will move forward to the video. Not at this time? No problem. All right, for sake of time, we have cut back on sharing their bios, which they have diligently followed instruction that we had given them, but we're going to go into our questions. Each panelist brings a unique perspective of early care education and health to tonight's conversation. And I'm sure their insight will enrich all of our discussions on tonight. Now, before we begin, a few housekeeping rules. We encourage active participation from our audience. If you have any questions or comments, we will allot time to ask questions at the end. We'll do our best to accommodate as many voices as possible that are in this space. Please be respectful and be kind. We would love if you can minimize any disruption during the time that anyone is speaking. And we ask that tonight's discussion continues to be encouraged and brought to our communities. Our discussion tonight aims to be inclusive and to build a bright future. We may have diverse opinions, but let's remember to engage in constructive dialogue. And so without further ado, let us get started. We're going to begin with the current state of education. Our first question will be for the entire panel. So here's question 1. What are the most significant challenges facing early care and education in our community? And how do they affect our workforce, children, and families? Let's start to my far right, if you will.
Well, hello and good evening, everyone. I think one of the major things that are affecting our communities is that we do not have enough early childhood centers. So when mothers need to go to work, fathers need to go to work, may have a job, but if we don't have enough centers that we're able to send our children to, or our grandchildren to, or whatever, that can kind of hinder mom and dad going back to work. So I would say not enough child care centers.
And I also second that. There are not enough child care centers, and also there's not enough funding within the child care centers for the teachers, for the programs that the centers want to do. I'm coming from the perspective of a private child care center, and I've seen parents come in and they ask for the resources and things like that. And unfortunately, we don't have the funding for those things, so we try to reach out and find those resources for them. But if we have the funding, we can do the things in-house. So
I would say a key challenge in our community is how do we support our families with information and access around early learning milestones and supports around language development, and around thinking about how do we think about developmental milestones and helping our families as they need assistance and supports, and understanding the networks available to support them.
I would say funding is one challenge. More funding coming from government, I'm talking about at the state level, coming to pre-K. And then I would also say making sure that we could increase transportation so that everyone has access.
I'm also going to piggyback on the funding, as the provider Head Start and Early Start in the area. Head Start is funded federally, but they don't fund us appropriately for all of the items that we're all talking about. So we do our best with what we can. Transportation is one of them. So you have to pick and choose what you're going to and how you're going to serve families based on the funding that you get. So on the state level, absolutely. On the federal level as well, definitely more funding. We can't serve every child in our community because of the lack of funding. Lack of funding also affects our child care partners. I may be well-resourced, but they're not, and they have to raise their own money to do things and keep up with all of the licensing and requirements. That all costs money, but they're not supplemented for that as well. So funding is definitely on the top of my list.
I do have to agree with the rest of the panelists as well. I do see that transportation is an issue to access to childcare. We do not have enough childcare facilities, slots for children, so that hinders parents that need to go to work. So I totally agree with the rest of the panel. Dr. Finney?
Okay, they took most of my responses. The only thing new that I would like to add, I think one of the biggest challenges as well is also respecting the position of a teacher and really looking at the fact that our child care workers are underpaid, our family child care providers are underpaid, despite the fact that we invest money in prisons, we invest money in other social activities, don't really invest money directly into those teachers' salaries. But also there's equitable distribution of funds in our particular county as well. And I think for that we need to look at that as an opportunity as well, to work like we do in a partnership, to make sure that we look at ways to grade money, to make sure that we support these teachers in the field, but also these children and these families.
Thank you. There's a common denominator in this lineup of answers that you all provided here. Childcare spaces, resources, and particularly funding. So thank you for sharing. Before we go to our next question, I want to make sure that we have ample space to make you all feel comfortable. An additional chair has been made available to anyone who would like to come and sit here. Thank you so very much. So our next question is also for the entire panel. So the question is, what local, state, or national policy changes are needed to improve early care and education? And how can community members advocate for these changes? You will start here this time.
So the one thing I'd love to see is what happened with kindergarten. It become universal, so that we have policies that states support funding adequately in all school districts to provide universal pre-K.
Okay, I would say first starting at the local level, when I was working closely with our local government, city and county, I do want to thank our city and county. Something that's unique about us is that the city and county does fund early childhood, so let's give them a hand if they're in here, because the city has done a great job there. But I think we need to do a better job as it relates to the state and lobbying for them, particularly when a lot of our funds come from the state. And one particular program is our wages program. Right now, we actually have to come into our own budget to support that. But ideally, what we're lobbying for right now is really for wages to be actually directed, funded from the state to the wages program. But also, when it relates to subsidies, it would be great if the state as well could subsidize the subsidy program. That's not something that normally a local government would do, but there are some cases where the state can actually give additional dollars for the subsidy program. But also, some of y'all may be aware that there's also is federal dollars just out there, but we can also get a better share of our federal dollars into our particular community by doing something together when federal dollars come out for early care and education.
Part of DSS funding is coming from the state, but there is a part of the subsidies that our community receives, and it's based on education. That's their need to access child care. And currently, they only receive 20 months for the child care subsidies while they attend higher education. And as we know, it takes 4 years to get a college degree. And so I'm looking for some avocation around extending that so that parents can stay in school and get their 4-year degree instead of they have to find another resource after 20 months. So that's big on my agenda tonight.
Early Head Start is federally funded. However, it goes in front of Congress every year for refunding or not refunding. And they also determine whether or not we are able to supplement some staff salaries or not. So at our level, where we are federally funded, we do a lot of advocacy about speaking about what our program does, who it serves, how it serves, what the impact is. And that is a focus of my staff as well as mine to continue to do that. I'm hearing that funding for pre-K is a multi-tier initiative, and we need to be involved in speaking at all levels to make sure that the funding continues to come in addition to other funding to help us support the initiatives that are passed to us.
I will reiterate what Paula said around our state funding and the fact that we aren't given state funding like allotments like we are for the other grade levels. So with the other grade levels, you're given so many allotments, so many teacher units, or however you want to call that, and that is not the case. So much so that we just recently received supplemental dollars for a kind of a bonus for teachers, and pre-K wasn't included because they're not included in, and that's coming from the state, they're not included in the formula, kind of in that funding formula. There is money that comes from the state, it's just not handled the same way. So and I'm not the expert on it. Paula can tell you much more. She oversees our pre-K department in our district. But yeah, so funding, like having it be just another layer of schooling, and right now 4-year-olds are the target, but I think it needs to start at 3. I mean, that is wishful thinking. If we're not universal at 4, I'm not sure how to go to 3, but I would love us to actually, as a state, get to where we are have all 3- and 4-year-olds in an early childhood program. So it really is just there's gonna have to be a mindset shift that this is part of the educational journey, you know, from pre-K all the way to grade 12. And that's not the case right now. So that's the work that has to be done. I will say the work of pre-K priority was great, and hopefully will continue to be as we move forward. Oh, sorry.
Yes. And my statement or response is pretty general. Just to piggyback off of the professionals up here, the key word is definitely funding. So the policies that are put in place on the local, state, federal level, they need to encompass everything dealing with early childhood education, from funding for the centers, funding for even the home centers, not just, state and federal funded programs and things like that. Funding for all teachers. I know healthcare is a big thing, but even getting healthcare for the teachers for, privately funded home centers and things like that. So just the key word mainly is just funding and just having policies in place that kind of encompass ways to get that money where it needs to go.
I just want to piggyback on what everyone else has said. Definitely want to advocate for more funding and also affordable child care. So definitely advocate on those two.
Very good answers, and I thank you all for sharing your thoughts. As a person who lives in the community, so I'm going to pause for a moment and pivot to just kind of give some context, if you will, to us as community members, the part about advocacy. Who wants to pick up on giving us an answer on what should we do? What are our marching orders to advocate for early care and education? There is a funding component that you all have said is layered. How, as a community, can we get involved in champion early care and education?
I'll start. I think one thing that I think is a positive thing in our particular community, particularly as it relates to the school district and Head Start, which is normally the provider, as well as the Smart Start, is that we actually work very closely together, particularly whether it's around pre-K priority or even around infant and toddler care. That's one thing we also forget about is those infants and toddlers. So I think we're there from that part, but also with the pre-K priority, I'm sure Tracy's going to talk about as well. That's another avenue to advocate. More importantly, this is when we have events, particularly as it relates to state legislatures, it's really important to be at some of these meetings. A lot of these meetings are virtual. I've been to some of those, and to be quite honest, I'm sometimes the only person there in our entire community. But those are some very important meetings where they're actually asking for questions about licensing, about funding, about school readiness information, about changes that impact your lives, particularly our quality rating system that's changed. But it's very important as well that we have a position statement that's the same coming from our community, and we don't have splintered logistics when it relates to lobbying for education and early care and education. I think that's one avenue we can do to move forward.
Anyone else want to answer that question?
I can answer that. On behalf of the Pre-K Priority, the Pre-K Priority has put together information on the website that's very easy statements to say in support of early education. So we feel that we've created a place people can go to say, okay, if I go to these things, what do I do and what do I say? There's a lot of information on there. Today we have yard signs, and just if you want to pick one up and stick it in your front yard, and that will bring awareness to even ask, what is pre-K? There's a website, let me see, and go that way. So there's a whole bunch of things people can do. It just depends on where your heart is and what you want to get behind.
Absolutely. Thank you so much.
Can I say one thing that when we talk about school, I think if we all start talking about pre-K to 12, and I said that a minute ago, but I think it's really important because a lot of times in any conversations about public education at the, and I'm not talking about college but just the kind of that K to 12 space, we need to start saying pre-K to 12. I think using that language in everything we say will start to say that we are committed to that entire continuum starting at pre-K instead of leaving that out. And that's kind of historically, it's been K-12. And we're not, we're a pre-K-12 system.
Thank you very much for those answers. We're going to go to our third question, and this question is for Dr. Finney and Superintendent McManus. What strategies can address the disparities in access to early care and education services among different demographic groups within our community?
I can start. One thing we established the past year, we're the only one in our state actually is an equity manager for pre-K that's funded through the county. And what this position actually does, and she's actually here now, our equity manager. She can wave her hand real quick. Is she somewhere in here? Okay. And part of what this position does is primarily focuses on early care and education to make sure that we have equal access in certain neighborhoods, what we found is in certain communities, you did not have early care and education. There were deserts in certain communities. There was inequitable financial distribution in certain communities as well. And with this position that was established the past year, and again, it's the first and only in our state, is really look at that, but also come up with a strategy how we can bring resources to those specific communities.
Yes, that is, and I think that Effie is in here as well, who they work closely together. But that is a great role to make sure not only do we have the seats available in all parts of our community, but are they providing the same quality of learning experiences for our students? Are teachers being provided the same pay? Like to Lewis's point, that role is really critical. So we're so glad that I think that was funded through ARPA with the county.
Yes, correct. And the other part of that we looked at is also equitable salaries as well.
Yeah.
What this grant does as well is look at providers to make sure that they have equitable pay to the public school teachers as well. So we looked at pay distribution in that particular project as well.
And I think the other strategy is really if we talked about the obstacles of transportation, and so having seats, enough seats where I can send my 4-year-old to a school close to where I live, there's sometimes you're not going to have enough seats sometimes to be able to do that, and so then you're having to transport young children, but there's no transportation except unless you're in getting services through exceptional education. So I think that the strategy that could break down that access is enough seats throughout, whether they be in Head Start, and in private, in other programs and in the district programs, or whether making sure that our kids can get to them, and if not, then transportation needs to be provided. So I mean, those are strategies that we need, one or the other. Either have more seats and have them in every neighborhood, or provide transportation for all of our pre-K kids. So it's if we really want to get to where all kids can attend.
So I would just add one more strategy in thinking about just navigating the system around you have a child and you have questions. Where do you go? Like, where's your first stop shop? I will say the work of the pre-K priority in helping to use apps and information and questions to help families navigate. We need to create more awareness around that, because families are saying, you know, I have a 3-year-old, I have concerns and I need support. What do I do? Or I have a 4-year-old, how do I get enrolled in pre-K? And I think what I love is we have partners who are working together, but every family's entry point is very different. And so how do we help families navigate the system to get access to supports and services for their children?
Absolutely. Thank you so much. Do you want to add something? So this fourth question is for Dr. Wilkins. How is the district partnering with Smart Start and Family Services to provide greater access?
Well, I think there's a lot of conversation in a lot of different ways. I will say, one, the collaborative networks that we've created, and I know both Dr. Finney and Tracy Ross are both newer to our roles, but I think that the partnership within the 3 organizations has been able to morph due to the collaboration through the pre-K priority, which we just noted. I think the other piece, everything from collaborative agreements, everything from the equity position to what we do with our MOU with Head Start as well, and early Head Start, and thinking about how do we navigate the landscape for families, family education, workforce family resource, and all of our partners and data systems, I think are another part of that puzzle. And how do we use each partner to help to maximize family support, teacher education, and teacher professional development? I think that's another piece as well.
So I just want to add a little bit. So what does that look like currently?
So I'll say from a school district perspective, I know in a lot of our early conversations, we use a tool called Teacher Strategies Goal, which is about looking at a continuum of development for children. And so that has become more conversation of how do we use that more widely in the pre-K landscape so that we can have a consistent metric to think about where are our children, and then as we follow them, because they all mostly enter the school system, to see the impact over time, both through early learning access and how students are performing when they have had access to pre-K. I know that's one fundamental piece. I see Adam, I'm looking at him right now. We've been talking a lot about data systems. The data sharing project, I think, is another huge opportunity for us to think about how do we think about getting data to help support the needs of the system and where we need to improve both family support, teacher professional development, and just the system in general to support our families.
I have an additional question to that, to the data sharing component. I know that has been something that has been worked on for many years to come. As things progress and transition, where would you say that data sharing partnership has evolved to? Has it been beneficial, and has it certainly brought the outcomes that you had desired for it to do?
I think it's continuing to grow and improve, and I'm looking at Adam because he is the expert on the partnership and just the management and collaboration. But I think what I have seen over time is access of community partnerships to collaborate with the system on data so that we as a community can get the information to know how to better support the school district and to support the students that services are being provided. I know we talk in cabinet a lot about there's so many folks that are touching students that are served in the system, but how do we know the impact and how do we really get a handle on all the services being provided? And the data sharing project is one critical way that I think helps us improve that as a system.
Thank you so much, Dr. Lucas.
You're welcome.
Thank you. The next question is for Dr. Finney. How can partnerships between early care and education providers, Head Start, schools, healthcare professionals, and community organizations be strengthened to support children and families better?
I think one of our primary roles is really to focus with prenatal and starting from the beginning, and that really starts with the maternal health program that fortunately the Department of Health has in our particular county. So we make sure that we work closely with that particular organization as well and support the Nurse Family Partnership Program, but also whenever there's opportunities out there for infant and toddler care, we find that that's a priority for us as well. I know we focus a lot on pre-K priority here, but the reality is it really starts at prenatal. So we're somewhat behind other communities when it relates to services, because when I talk to families, what they really need is infant toddler care. So we make sure we also work with those groups that serve infants and toddlers, but also the preschool aspect as well. So we kind of work in general with all the groups, particularly with the county, as well as with family service and the school district to make sure that we have that marriage.
Question for you, Dr. Finney, before you complete that. How many families would you say, do you have that at the top of your mind? How many families do you serve?
Okay, we look at all of our programs, particularly at Dolly Parton, we would say a little over 13,000.
Very good. Thank you. Thank you. I appreciate your answer on that. All right. Our next question is for Ms. Sharita Sutton. Question is, what strategies or initiatives is the health department implementing to ensure the safety and well-being of children in early care and education settings, particularly regarding infectious disease prevention and overall health promotion?
The Forsyth County Department of Public Health, we have several programs. One in which, when addressing those areas of concerns, infectious disease prevention, overall health, we have in our environmental health our in-home lead testing and education, which is very important. And we also provide our dental services, and we also have where our preventive dental services go out into the schools and into the community to ensure that our children have their dental health. We also have our back to school immunizations and our care clinics. As Dr. Finney talked about, we have our maternal child health programs, and so we have several home management programs where we have nurses and social workers that go out into the home. We have our child care facilities, inspections that are inspected by environmental health. So those are just some of the programs and ways that we are able to look at our overall health promotion.
Thank you, Sharita. I appreciate you sharing that. So how would someone be able to be familiar with the programs that you all have available? And do they come at a cost or are they free?
So many of the programs are at no cost. For more information, we can go to our Health and Human Services of Forsyth County website, and all our services are located on that website, and there are contact information in there. And we also have a resource directory guide on that Health and Human Services for Department of Public Health with all our services, the contact names, and if there is a fee associated with that, which many of the programs do not have fees associated with them. So we definitely can go online and look up that information.
Thank you. I do appreciate you sharing that information. Our next question is for Tracy and Chantel. What is the pre-K priority, and what strategies are they working on?
The pre-K priority started about 7 years ago. It's been grant funded by the Kate B. Reynolds Charitable Trust all these 7 years. And it is a community stakeholder group that is involved and wanting to come up with strategies to identify uniformity through our pre-K system. Right now we are focused on 4-year-olds, but we are starting discussions about focusing on 3-year-olds. We say that when we have universal pre-K for all 4-year-olds, we'll start working on our 3-year-olds because we do believe that early childhood education begins at pre-birth, really, as Dr. Finney said. Some of the strategies that we're working on, there were 19 recommendations that came about from a task force that worked tirelessly over time. And those recommendations are what experts in the field say that every childhood education program should have. The pre-K priority is looking at some of those strategies outside of the cohort, the ARPA cohort. ARPA cohort is focused on, I believe, 6 of those priorities. And then we're looking at the rest of them to try to figure out how to communicate funding is needed. We're basically trying to say, see, we can do this work, please give us the money to do it. One of our internal strategies is working through stakeholder groups. We have 23 members on our committee, and they're looking at family and equity, funding advocacy, of course, and classroom and student work groups. Is there anything you'd like to?
I would just like to say that I'm newly appointed to pre-K priority, and it's been a joy to serve on that. I would like to also add that I love that the pre-K priority, they're about educating, engaging, collaboration, commitment, and support. So I am here to support the community by serving on the pre-K priority. So we hope that we hear from the community by accessing the website. Thank you.
Thank you both for your answers. I do have a follow-up question to that. Being it that there is minimal funding and that you have to really pursue funding, is there a policy advocacy component to the work that you do as well?
It is. There is a division of our full committee that is working on policy advocacy, and I'm not part of that group. No, we're on different work groups, but from some of the summaries that have come out of that work group, they are looking at strategies to engage the community and also to communicate to our stakeholders and larger stakeholders that actually hold power, and to communicate the good work that's being done by all of our partners in the community.
Thank you. You want to add anything to that? All right, thank you so much. Our next question is for you, Tracy. What is Head Start and Early Head Start, and who is eligible for the program?
Head Start and Early Head Start are programs that are federally funded at no cost to eligible parents that focus on early learning and development, health, and family wellness. We recognize that families are parents or people serving as parents of children are at the heart of everything, and we engage them early and get them involved in their child's well-being. We also understand they're their children's first teachers and children's first advocates, and we work with parents throughout to do that. We are an evidence-based and research-based model. We have an actual curriculum. We use creative curriculum and TS teaching strategies, goals, or assessment tools, very similarly to our NC Pre-K and our school district. And Head Start's a love of mine. Ever since I started working in Head Start, I honestly saw how it brings families in and engages families and works through the entire comprehensive family unit to make sure the child is successful and school ready, ready for school, ready for kindergarten.
Thank you. Our next question is for Chantel. How does the general public access childcare resources in the community?
We have several different ways that you can access child care resources. You can actually come to the Department of Social Services. We supply, you can apply for our child care subsidies. You can also go through Smart Start, of course, Head Start, as Tracy just talked about, and Child Care Resource Network will also guide you to the resources that are located here in Forsyth County.
Thank you so much. Our next question goes to Dr. Finney. What innovative approaches or programs have successfully improved early care and education outcomes in other communities, and could they be adapted here? Be specific, please.
I would be specific. I think I would start one with workforce innovation. Something that we started that we're also anticipating on doing in the fall as well. What we found nationwide, but also locally and statewide, is one of the biggest issues is actually impacting the workforce. So it's really critical to have apprentices programs to really train people, particularly starting at the public schools and college, to actually want to be teachers. And it's unfortunately that in 2024, that we still look at teachers as a second-class job, even in public schools, but also in pre-K. So it's really critical, and one of the things that I'm really proud that we're starting to do is really focus on the workforce and workforce innovation to really try to get teachers employed and working in pre-K. And I think another innovative project we want to really look at, and I want to make sure we don't discount, is parents, and something working specifically to support parent engagement in this community. Now, something we failed to mention before as it relates to advocacy. Advocacy also starts with the parents advocating. So we're also really going to start promoting our family engagement programs, and particularly promoting our program that works with dads.
Can you share a little bit more about
Sure.
the program with dads, please? Thank you.
Yes, we did have a program started this year in partnership. We have some members from Alpha Phi Alpha. Also, we have, it's funded by Reynolds Foundation as well. And that's a program here to support the pre-K initiative, but also family services. And I'm really proud of looking at the data and how that actually results in getting these dads involved in these children, but also how it's actually proven to change some of the school readiness and preparing some of these kids for school. But also our workforce program, part of it now is currently funded by the county. What we're really proud about that is that it looks at equitable pay amongst the teachers in our particular community and giving them salary increases. We also give out teacher bonuses. This program also focused on giving teachers college degrees to get them ready for school. So those are some of the innovative projects that we started this year. And we're also looking at some new projects specifically focused on infant toddler care and trying to pull out federal dollars in our particular community as well.
Thank you, sir. I appreciate you sharing that. Our next question goes to Aola Sims. What are some of the most common barrier families face when accessing child care services?
Some of the things that I've seen are, like we've mentioned before, just a lack of centers that are open, or a lack of slots that are available for care. And another thing is just being knowledgeable about all the programs and services that, we all are talking about today. There's a lack of knowledge there. I have parents that have come in and they've asked, what is the registration process, or, is it extensive? What are they going to want to know? So we kind of walked them through that, and we also mentioned, like the subsidy and things like that. They don't understand or know what they have to do to kind of get that child care paid for. There is a lack of, money on their end. They do need that voucher. A lot of our parents struggle to even pay the parent fee. So just finding resources for that is something that myself and the other director work on.
Just basically, you know, a lack of care, a lack of, you know, knowing how to register and things like that, and
So would you say that it's fair to say that during this process, it's important for parents to have someone who's going to help them navigate through the system?
Yes, it definitely is. And from my standpoint, I get a lot of grandparents actually that come in, and they're actually taking care of these kids, their grandkids, and you know, honestly, they're tired, and the kids, you know, are missing out on their social skills. The kids are missing out on just, you know, developing and things like that. So the grandparents ask, you know, how can I get my daughter involved, or how can I get, you know, my grandkids signed up? So just putting forth that knowledge, myself and the other director, we do like walk-in tours. I am trying to network in the community. I've made some connections tonight of other, you know, privately owned centers, home centers, or home child care centers, and, you know, large centers that may have opening slots, because there's no database or anything like that that I can physically go in and look and see who has what available. So I feel like just making those connections will also help the parents when they're out here looking for childcare.
Thank you. Our next question is for Chantel. What are the requirements for accessing subsidies from the Department of Social Services?
That subsidy is based on income, and it's based on the number of family members, and so the income level is adjusted based on the number of family members. It is based on need, so you either have to be employed, in school, or have a developmental child, and we will support that. There are some outside criteria as well that we support domestic violence. So if you're in a DV situation and you need help with childcare, we do supply vouchers for that resource. Homelessness, we also help and assist with that type of situation. And grandparents, since she just brought it up, we do support grandparents, and they do not have that 10% that most parents have to pay for child care. So grandparents, we do not count their income for the income limit. So the child is eligible to receive the voucher. And so like she said, that helps with those social skills and getting them in a placement to develop. And so you can just apply at social services. We also have resources out in the breezeway when you walk in, if anyone wants to pick up any materials related to social services and how to apply.
Thank you. I want to pause and just kind of reflect on a few things that you have already shared. So much information, so many resources that are available at no cost. What are some of the things, and anyone can pick up this question, what are some of the things that you are doing at your agency to ensure that the public, the community, is fully aware of the great tools that you have applicable to those who are of low income and who need to be met at their point of need now? Anybody wants to?
I'll be happy to. We are committed at Forsyth County to come out to any resource fairs. So we have began that journey, you know, we're post-COVID, so now we're in that journey of connecting with our community partners. So if SMART starts out somewhere, we want to be out there too in the community. We most recently had and paired up with, I forgot the name of his organization, but they were down in the Rolling Hills apartment complex off of New Walkertown Road, and it was a blast to see.
Cure violence.
Yes, thank you, Pastor Friday, I believe. That's yes. Correct. And it was a blast to see the community come out, and we were able to support them with resources that we offer at social services. So we are committed to support and get out in the community more and more.
We do similar stuff in Head Start. We have a team of family advocates that are not only working with their own families, but out in the community talking about Head Start and early Head Start and how you're eligible. And as I said, it is a no-cost program for eligible people. The team speaks to parents, understands need, and then determines if the child is eligible or not. So there's a criteria we follow, which helps us find the most neediest and most vulnerable children in the community to ensure that they're in our program. They're in the community, and that's how we try to reach our families.
Same thing for our Forsyth County Department of Public Health, our Health and Human Services. We are committed to meeting our clients where they are. You know, I remember Dr. Shaw some years ago said it's time to take public health back to the public, and that's where we are. We are boots on the ground because we understand we need to meet our community and meet our community, our children, our parents, where they are. And so that means we have to come outside the four walls, but they also can come inside. And so we meet them in the community. We also can meet them on our social media. We know we have to meet them where they are as well. And so we're out there in social media. And so that's how we're meeting our community.
Thank you.
And can I add one thing? So at Enriched Kids Academy, we've been open for about a year now, and we are solely based, I mean, we've got most of our children just by word of mouth. My sister, Charlotte Sims, she has a good report in the community. And this Friday, we're actually closed. It's Good Friday, the center is closed, but the teachers will be working, and we'll actually be going out to neighborhoods in the area, businesses in the area, and just talking up Enriched Kids Academy and the things that we have going on and things that we want to do through our up-and-coming nonprofit.
Thank you.
And at Smart Start, we do wonders events like this. This is actually our first time going to the community and really expressing and doing something about the importance of early childhood. But also what we started doing this year is working with another organization that does charitable work as well, Neighborhood Hands. And that's what we do a Thanksgiving giveaway for families, but also we do a Christmas giveaway for families as well. And pretty much shut down for that day just to give back to the community. But we also have several events where actually I see a lot of you all at some of our events as well, such as health fairs where we give out free health services to the community. We also have events in the parks for the communities as well. But it also we make sure we have bilingual staff on board to make sure that we're speaking the parents' preferred language, because we find that being something very critical as well.
And I would say for the school district, there are a couple things. One, if you are not aware, we now have one preschool pre-K shop. Before, our preschool services for our 4-year-olds was a separate department versus our preschool for 3-year-olds for our students with disabilities. And so now that's one place, and it's all at our Special Services Center, which I call it the playland of all great things pre-K. And so when families come to that, they can ask their questions, really understand how to navigate the system, everything from the application process. We're also working with community partners to figure out what events we can promote awareness and supports about how the school system provides services for preschool and pre-K. Our itinerant teachers are another part of the puzzle in thinking about in-service home supports for students, especially our students with disabilities. And so I think we have a lot of coordinated efforts to help our families.
Thank you. Thank you for sharing that. Our next question is for Superintendent Tricia McManus and for Tracy as well. Why is pre-K essential, and how does it impact future learning?
So pre-K, so brain development, as we all know, starts before birth. Starts before birth, but then so much development takes place in a child's learning from birth to kindergarten. And so to provide that early childhood experience allows our children to start developing social skills, number one, developing confidence, develop skills, not only social emotional skills, but also those early skills of speech development, of language development, of vocabulary development. So when kids are around other kids all day long, when they're 3 and they're 4, they're developing those skills that are going to help them later on. And there's a lot of research around it. When we talk about achievement gaps that are created as children go up to like 3rd grade, we could pretty much eliminate those if we could start early with all students, provide that experience of early childhood, and start to close any kind of language gaps that may be occurring. We did a session a couple weeks ago about brain development and the importance of kids being able to talk and being able to communicate and collaborate, and that starts early. And so I cannot say enough about the criticality of our students starting their educational journey in pre-kindergarten. So I don't know if you want to add anything, but it also, there's other kinds of research, which some of it is like the difference it makes later on with jobs, with, the list goes on and on of the impact of early childhood education. So what else did you want to add?
I think I agree with all of that. And what I would add is early childhood education, or preschool experience, starts to teach classroom habits, starts to teach just the idea of having a place to go, going to school, attendance at school. The importance of attendance at school starts in our preschool programs, and that carries forward into elementary, secondary education. And usually a child that goes to preschool and establishes those habits early is more successful in graduating from high school than those that don't. And that in itself it just says a lot. In addition to some of the things Superintendent McManus has said, is it's also an early prevention program. Having children be involved in activities in preschool with teachers and positive role models and engagement, and someone having eyes on a child on a daily basis helps protect children in our community. It's some of our programs, it may be the only meals children get, some of our children. So it's so integral in so many ways in serving the whole child.
Thank you for your responses on that. It is so important. I'm sure that you have a lot more technical terms that you can use to really share that information with, but you touched in speaking to even the food piece and how it is so important. That could be the only space and place where our children are eating is certainly something we need to work on together. So thank you for sharing those responses. Our next question is for Sharita. What are the key health priorities for children in early care and education programs, and how is the health department collaborating with educators and caregivers to address these priorities effectively?
So we have in our preventative health services, we have programs such as our Be Healthy School Kids, where we partner with Winston Salem, Forsyth County Schools, as well as some private schools. And we also have our community gardens, where we promote healthy eating and working with young children on understanding gardening. Understanding how to garden and some of those basic things. Healthy babies, as we talked, we have our home visiting programs. It's very important for us to have healthy babies, healthy moms, healthy babies, our safe housing, as well as early childhood literacy, and also food. We understand that we have food deserts, and so we do have our programs as healthy communities. Going into those food deserts and working with some of those community stores and creating healthy corner stores by providing healthy options in those various healthy food deserts.
Thank you. I do have a follow-up question to the growing food piece. Can you share a little bit more about that?
Yeah, so one of our programs with our Be Healthy School Kids, as well as our healthy communities, we have what we call Take What You Need. And one of those things, we have a garden, and we have fruits and vegetables, and we take those fruits and vegetables, and we provide them to those healthy corner stores, and those food deserts that may not have healthy options, and we give them for free. And those individuals in those communities are able to come and get those vegetables at no cost. And so it's very important. And then also we have with our Miss Alex from our Be Healthy School Kids, she has a program, and she's teaching children and their parents about gardens. And so that is something we want to give back as well and teach parents and teach children about those things.
Thank you. Thank you.
If I may.
Absolutely.
We also have a similar program in Head Start where we have vegetable boxes, and we're growing vegetables outside of our classrooms, and we're inviting parents in to learn how to do that so that they may be able to do that in spaces or community gardens that may be close by to them. And then carrying forth what we grow into our nutrition program, where our chefs are putting recipes together for families on, they may not know what to do with a zucchini, but now they do. So kind of pig a little bit of what you're doing too.
So would it be safe to say that there may be even collaboration with some of these efforts, not just with those who are here, but different agencies such as Cooperative Extension, for instance, with the county?
Absolutely.
Yes.
Very good. Thank you for sharing that information. All right, audience, as we move to the next focus of our agenda, we want to give you an opportunity later on, just in a few minutes, to ask any pertinent questions that you may have. We will come to you with a mic and you can ask our panelists your questions. In the meantime, we have a few more questions for them to answer for us that have already been prepared, and then we'll move it on over to you. So our next question is for the entire panel. Given the critical importance of early care and education in shaping the future of our society, what specific plans or initiatives do you have in mind to ensure that our town prioritizes and invests in early childhood development?
We are about to go into budget. We are in budget season, where we'll be going to our county with our budget requests, but we have a budget workshop with our board this week, and pre-K will be one of the topics that we'll be discussing on what are we going to, how are we going to address that in the budget process. We had for many years the support of a public funding with Project Impact, and that was the public, like private people raising funds for us to be able to support pre-K. Those funds are gone. We had ESSER funding, which was over 3 years, which was $215 million to support the impact of the pandemic. Those funds are gone. And so we are now going to be discussing how are we going to address that. So I think one way for us is we're having this at the budget conversation and the budget table. What do we need to ask for? What do we need to advocate for in our legislative priorities as a school, as our Board of Education comes together? What are we going to look at as priorities to take to our legislators, and pre-K will be one of those items.
Thank you, Superintendent. Before anyone answers that, would you keep us abreast of those final discussions, as for those of us who enjoy advocating on behalf of the underprivileged, is to be present and to speak up for those things that you champion?
Absolutely.
Thank you so much. Dr. Finney?
Yeah, one thing we're doing, as well as working with our board, is we're also realizing that our ARPA dollars as well is sunsetting in around 2025. So we're looking at other funding opportunities, particularly around infant and toddler care and some child care partnership, to try to replace some of those funds that we may lose when the county ARPA dollars are gone. The other thing that we're looking at as well is related to workforce. We shifted some of our priorities to really focus on workforce development, but also more money into the children's centers, because we also noticed that the state this year, their budget line item for Smart Start, did not give us the same amount of funds that we expected. So real important for our perspective is to really look at diversifying our funds, because we understand that everything is not promised, but it's also our role and responsibility as well to not depend on one single point of failure when it relates to funding.
I come from a service-oriented family. In Rich Kids, we have a nonprofit side, and we are excited to just get into the community and start our family nights, start our parent training and development, just get the funding and things like that for our parents' night out, just giving the parents a break. So we have various initiatives going on in our center as well. We had a family that lost, their belongings in a fire, and we started the Give a Little, Take a Lot initiative, where parents and even the neighborhood businesses. We have like a Sit-Go next to us. We have Zoe's Family Restaurant. They allow us to like advertise, and if people have, brand new things that they want to donate, we keep them in the center, and people can come in and take a look in the director's office and take what they need. So we're doing things like that as well.
I would say that through the work of the Pre-K Priority, we are looking at how do we communicate some of the good work we're doing in our private care settings, in our public care settings, in communicating that to have people understand the importance of what we're doing. Secondly, the work of the ARPA partners in putting together that data in order to tell the story of the hard work that we've done in the past 2 years will hopefully spur some a higher look at this is something worth investing in.
We're committed at Department of Social Services to continue to support the community, be a part of these conversations with my peers up here on the panel. We're happy to come out to any event to support in any way we can. And so if you need us, please just reach out. Our contact information, I will be happy to leave it out in the forum. And that's our way of showing up in the community to support you all.
And we are definitely committed as well to ensure that our community know the services that we do provide at the Health and Human Services, at Public Health, that they are aware of all the services we provide, and also, as I stated earlier, to be out in the community, to listen to our community. We have some programs that we have listening sessions to listen to them, like our community health assessment, and meet those needs of our community.
Just add, in addition to the funding piece, just thinking about the experience in integrating, and you've probably heard Superintendent McManus talk about inclusionary practices, and so we have blended pre-K classrooms where there are typically developing children with exceptional needs, working together in the same classrooms and thriving, right? And so on the landscape of preschool, we want to see how can we begin to expand that opportunity for more of our students to see and experience what we see in the real world, right? And so for us, that's a really heavy priority, and thinking about how do we do that more and scale it and expand access as well.
Our last question. How do you each intend to collaborate with local and state organizations, educators, parents, and stakeholders to implement these initiatives effectively? Similar, but just a little bit more local.
I think it's important for us to be at the table with our community partners to work. We've heard the saying, we're better together, and working with our partners, as we stated earlier. I think someone like working closer with Smart Start, working closer with various programs in our area. And so that is something that we're definitely committed to do.
And I, and Rich Kids Academy definitely is very grateful for Smart Start. They've put us on to United Way, and we received a grant that allowed us to do wonderful things in our center. So like she said, it's all about partnerships, and we've had Goodwill come in and speak to our parents and things like that. So just making connections, getting into the community. We also worked with Parenting Path, and we're trying to get like respite care and things like that set up. So again, I agree with her. It's about the connections.
Same with us. I mean, we can't say enough, any of us, about working with everyone, working with local government, local groups. I have staff members that serve on boards of both of these organizations because we want to be at the table regularly. We work closely. There's a network of folks that have recently in the last year come together called Thrive Together, and they're trying to figure out, and many people in this room have been part of some of those conversations, but trying to figure out from birth to, post-secondary into careers, how do we start to funnel resources specifically to organizations who can support our youth all the way up at different points of their life? And so who are the best providers? I see folks in the room that do incredible work at birth, with making sure they're providing resources to families and to children, and then do incredible work at the pre-K level, or incredible work at to support third grade reading with the school system. And so that we are part of those conversations about how do you start to really have a continuum where we start to be smarter with our funds, because if we spread them too thin, we can't make an impact. And I think since I've been here, this is my 4th year here, I've heard this over and over and over, and I feel like we are starting to gain a lot of momentum around working together. I know Saturday, I was there as well Saturday in the Rolling Hills community. I love, because Chantel was there, and she's like, we'll start inviting the district to more when the county's out in the community. That would be awesome, so we can come and also, meet our families and talk to our future students when they're, 2 and 3 years old. So all of that kind of ongoing collaboration is critical to us too. And then just keeping the messaging going above us to folks that are making laws, making policy, making decisions that impact our youth, because I'm not sure they're always in the community. So I think that we've got to kind of be that go-between from our community up to folks that actually have the power to make change. So we're committed, and we're grateful to be at the table with everyone.
Partnerships, definitely. I mean, I can't echo that enough. Family Services' tagline is a community of solutions. So we work together with the community. We know that the work that we do, we can't do it by ourselves. And collaborating with our partners and reaching out to our partners. When we see a need that needs to be met by one of our families and we can't do it, we find the partner that can. It's also about including stakeholder information in some of the decisions that we make, going to our parents and saying, what's it like to navigate this system? Help us to understand. We have a group of parents that serve on our policy council. It is a board of directors for Head Start, and it's parent-driven. And they impact our program. So in addition to going above us, we can't forget to go to our parents who are utilizing our programs to say, are we meeting your needs? What else can we do differently? And making sure that we include them in partnerships.
Well, I think everyone has said it best on this stage tonight. The partnership is so important. And again, I concur with commitment. So we are here from Forsyth County to support.
And I concur with most of us are saying as well, but also agree that most of us here actually have either some type of written partnership together, or we do some work together or sit on some type of committees, which for me, being here 4 years like you were, that's actually new to me from other states that I've been to. So I want to say thank you to Winston Salem for that great experience. But what I'd like to see us do as well is do a position paper that's all one united front that we actually submit to our state legislatures coming from our particular community, just telling what we would like to see for 0 to 4. Because we do a pretty good job, because I also meet routinely with the county officials as well as the city people. So we don't have that issue when it relates to the fracture aspect of it, because I do believe as a community, the whole community wants us to do well. But I would like us to have one specific initiative together that we send to our state legislatures about early care and education.
I would just add to the collective vision that Dr. Finney just talked about, and I think we all have visions and dreams for our community, and doing that together and signing that together would be very, very powerful. But in addition to that, just thinking about each partner's strengths and how we leverage that for the power of the work of pre-K. And I just think about the school system. I know we can provide additional support around momentum because of the numbers of teachers, around support with professional development. So if each organization thinks about what they have as a great strength and how does that add value to the collective whole, I think it will continue to help us gain momentum.
Well, Well, thank you, ladies and gentlemen, for sharing your responses and your expertise. I'm going to ask that we give them a round of applause. They are hard at work ensuring that our little ones have what they need to grow. Now, our next portion for the next 15 to 20 minutes, we want to give you space and time to ask any pertinent questions. And Mr. Jawan is going to come through with the microphone and bring it to you. Should you have any questions, just raise your hand and he will come to you. While he is coming to you, I want to take this moment very quickly for us to congratulate our incoming county manager, Ms. Chantel Robinson. If you will stand, please. Thank you so much. Yes, ma'am.
Good evening. My name is Danette Bailey. I operate Bailey Preschool, a center located on Polo Road in Winston-Salem. And lots of the panel members mentioned an important thing to you is that we have more spaces for childcare, and as well as Dr. Finney noted, professionalism, respect for educators. So I would like to ask, I have a lot of my colleagues here today, and as family childcare providers, they at least have a bachelor's degree, if not advanced master's degree, even like myself having a teaching license. And I'm sure I speak for us all when I say we would like to know if Head Start and Smart Start could commit to collaborating with family child care providers and centers and residents for these Head Start and North Carolina pre-K spaces, because these are underutilized spaces that already exist. They are spaces that exist with professional and educated teachers with lower child ratios, and this would benefit families. Of course, it would benefit these children, and it would benefit the family child care providers and centers and residents to remain open. So we'd like to know if you could commit to that tonight.
Absolutely, I'm glad you brought that up. In fact, as you speak right now, we're actually talking to some local private child care providers because we're actually looking at applying for some federal fundings to help support infant toddler care and child care partnerships. We'll help subsidize with some of our subsidy money, but also if funding is available through the Early Head Start application, we're actually looking at doing that right now as we speak. The other thing that we're looking at as well as it relates to NC Pre-K is looking for additional slots. In the past 4 years, we actually have increased the NC Pre-K slots in our particular community. And part of the reason why ours is disproportionately different from other communities is because as a community, we failed the past 15 to 20 years to actually advocate for the need for NC Pre-K slots. That process actually recently started the past 3 years and did lead to some increases. And actually our chairperson is behind you, that's Dr. Effie McMillan, if she can wave her hand. And I really encourage you also to go to those community meetings, and that's where we actually distribute funds for specific slots that's open to the public, that you can actually inquire and ask how you can actually get these specific slots. The other thing that we're trying to do from a state perspective, and that's related to family child care, is also get family child care out of that perspective of being a level 3, but up to a level 5. Because what that does to family child care homes is this allows them the opportunity to get those state dollars that the private child care industry gets. So when I had my conversation with our state director, their rationale was just regarding, that's area forward, was around the education and academic perspective of family child care. But what they're not aware of is the point that you brought up, which is that many of your family child care providers and private child care providers do have similar credentials than the public school teachers, but aren't getting the same type of pay and respect that the public school teachers are getting. So that's what I would commit and support in trying to do to make it better for the child care providers in our community.
Yes, you have a commitment from Head Start, and Dr. Finney is right. For the first time in several years that the federal agency, the Office of Head Start, is releasing new money specifically for early child care partnerships and Head Start child care partnerships. And we intend on applying for those dollars as well so that we could share those specifically with our childcare partners and new partners. We currently do have childcare partners and early Head Start childcare partners and family childcare partners that we work with already built in our model. And our intent is to continue to do that work in addition to some more work, which will create more spots for children.
I have a question here also. Now, you heard the man over there talking about dads getting involved. Now, how active are you all looking for young black men to be involved in early childhood, pre-K, or whether it be Smart Start? Because I personally think that it's very important that our babies see people who look like us in there. So are we doing any type of initiative to get more young people in there? They can be in high school, to get them to be involved in the early childhood education, because it's needed. You know, yes, we might get some dads involved, but I think we need to advocate to get some of these young men involved into doing this also. So what would be a strategy that can be done with?
I think you are so right. Like that is, your point is so spot on, and we are doing several things in the school district to try to address that. And one of those things is at the high school level, expanding what we are calling our teacher cadet program, and really trying to recruit some of our students, especially males, and we've got to address the pay, I will say that, so that they can keep being like, yeah, I do want to be a teacher and get certified and go to college for that. But that's one way, is through this teacher cadet program, which really starts to expose our high school students when they're in high school. And we're recruiting males of color as well, so that we can, they can actually get exposure at the elementary level and the early childhood level while they're in high school still. We also have partnerships with Winston Salem State and some of our other universities, bringing college-age kids into our schools to support in that way. And then we've got some high school athletic groups that are actually coming down and mentoring our young learners now. I mean, those are just three ways. The most systemic way, though, is going to be through our teacher cadet program. And we've got future teachers sitting in our high school classrooms right now. And so if we think about the demographics of our students in Winston-Salem, Forsyth County schools, we have 30% of our students are Hispanic, 30% of our students are Black, 30% are white, and then 10% are other races. And if you think about that, we've got the diversity in our students to then be able to have kids that look like them come support them as young learners. And I will tell you, our fastest growing population are Hispanic families. We also need to make sure that we have people that can communicate effectively with all of our families, which is really important. So do we have bilingual opportunities? So yes, so the answer to all that, yes. We are also open to other ideas. So if you have any, we will be open to that. We have a task force called the Drive for Forsyth Task Force. It was modeled after the state task force that Dr. Anthony Graham at Winston-Salem State oversaw. He's on our local task force, and that is honestly really to diversify our workforce so that students do see people that look like them. And I think, to your point, starting at pre-K is really important. So do you have anything to add, anyone, about those efforts?
I think in addition to starting that program called the MAIL program, I think it's very important as well to also look at the data, particularly with preschool age kids. About 65% of them are actually Black and brown boys. And when you go to these classrooms, 9 out of 10 is led by 2 females. So it's also critical to also make sure that you hire people that looks like the children that you serve. So I'm very fortunate, even in our organization, we're about 1/3 men in our organization that actually not just work with the MAIL program and work in the classrooms and centers, so when they go to those places, they actually see people that look like them. But I think it's very important as well to do a concerted effort to look out for African American males and Hispanic males, because believe it or not, there are those out there who do want to work with early care and education.
So I take it that there will, if this were to happen, and is happening, they will have some form of formal training in an effort to be able to know what they're doing, so to speak.
And yes, we do have a program that does that specifically, called our MAIL program. Actually, Jawan Crowell If he's here, he's the person who leads that program, who's born and raised in this community. So I think it's also important as well to get people from this community that look like that community as well, particularly if you want to serve young men, but also serve those young children.
Hello, my name is Shay Jackson. I am a family child care home provider at Modern Early Learning Academy. I'm also a stakeholder on the Pre-K Priority Steering Committee as well. And so my question is, well, my first question was, Danette, actually, we were thinking alike. But my second question is, with already a lack of available and affordable child care options in Forsyth County, when we know that the ARPA funding and stabilization grants are soon ending for child care providers, and it's a very scary time for us. For private centers, center and residents, as well as family child care home providers, and we are on the possible brink of a child care cliff. How are your programs preparing for this in hopes to support provider sustainability?
It's a powerful question. I'll make sure I give you an insightful answer. I think first, some of it I've kind of answered first is that, and that's that we're looking at the child care partnership, early Head Start partnership to kind of leverage some of our funds to help support the ARPA dollars that the county is funding us now. I think secondly is we're very active on the state level as well. I'm also a board member of the North Carolina Partnership for Children that funds my own agency. So part of what I do with helping that particular organization is look at funds and see how they can actually direct specifically to our community. And some of the things that have recently changed, thankfully too, where the current governor actually did allow us to get additional dollars for NC Pre-K dollars that you probably did not get, but centers did get when we gave out $2,000 bonuses for stabilization dollars. That's something that our organization lobbied for to get from the governor to go to help for the stabilization of grants in our particular community. That's just the first part that we're doing, and the second part we're doing is looking at federal dollars that are coming as well to try to address the point that you have, so we definitely understand what you're referring to. Thank you.
Good evening. And not that there's an answer for it, but I'm Ramona Brown, and I own a family child care home. It takes a village. And we've been in business over 25 some years, and as they said, we hold master's degrees, we hold bachelor's degrees. We're a very intelligent group of people. But in your narratives that I've heard, I really haven't heard you say anything about family child care homes. We're very familiar with Smart Start and all the rest of them, and we've been involved in those programs. But if we don't choose to be involved in those programs, but we are still on the same playing field, you know, and that's to get children from point A to point B, then some of all of these monies that we hear going around for some of these programs, we would like to be included in those programs as well. I think it's good that you're going to have children able, if their parents so choose, to put them in public school. That's a good thing. But as well as that, a lot of them don't make it in public schools because we know what's going on in public schools. So not that there's an answer for it, but I just want to put it out there that we want to be included too in some of these monies that you all have going around for pre-K students, because we turn out some great pre-K students.
You are absolutely right. It really boils down to parent choice, and particularly relates to family child care homes. How many family child care providers are in here? Okay. One thing that's a little bit different in this community that was unique to me as well, some of y'all may not know, but I'm also the past president of the National Association of Family Child Care, so I know you all very well. But we also have staff on board who are licensed to actually train and observe you to make you accredited in your particular center. We institute a lot of these programs with family child care because I agree to your point that there's a lack of infrastructure and also funds in your particular service. So any projects that we've started in the past couple of years always included the family child care providers. And some of the programs that we started actually started with the city and their social justice program, where we actually started 5 minority women-owned businesses in a partnership with CCRC just to start family child care homes. The second thing we did actually with the city this year is we hired a full-time family child care coach that works and focuses just specifically on supporting your work that's funded by the city. The other thing we did that got funded by the city with family child care homes was helping you with supplies, equipment, paying for Wonder School and other supplies and so forth. So actually, we have done a lot, but we have not done enough because it really boils down to parent choice. And from my experience in doing this work for over 20-something years, many parents have actually chose family child care homes as an infant-toddler preference than they did centers. So you do have a friend when it relates to family child care in this particular community, but there still is a lot more work that we need to do to make sure that they know that you are just as strong and just as capable as the centers, as well as the public schools and Head Start. But thank you for that question.
Good evening. My name is Crystal Pearson, and I operate Great Thinkers Learning Academy. I, too, have been open for over 20 years, 5-star daycare. I'm not interested in teaching infants and toddlers. My preference is 3, 4, and 5-year-olds. But if you're taking all the funds and putting it in the school system for the 3, 4, and 5-year-olds, where is that going to leave me? You're forcing me to have the infants and toddlers. Because the parent, if they have the option of going to a home daycare or the school system, more than likely they're going to choose the school system because they'll think it's a better program, not knowing that we are just as educated as the teachers, if not more educated in some areas. So I'm sitting here and I said, okay, we're here. We were invited to this, but you're all talking about the pre-K and the school system. I heard you say nothing about these home daycares and bringing those funds to our programs. So I just want to know. I mean, I have infants and toddlers now, but that's not my preference, but that's all that I'm having to call me lately.
As I said earlier, Head Start, which is 3 and 4-year-olds, and some 5-year-olds right before kindergarten, we do partner with family child care and child care partners. And we do have some new funding coming. And how we utilize that should be a community collaborative effort. So what I'm going to say to you is the young lady that is a few pews in front of you, Vivian Stearns, if you don't already know who she is, have a conversation with her. She's our Child Development Vice President and the person who works most closely with our child care partners. And she can talk to you a little bit about what's coming up in the future. And hopefully we can work together.
Yep. Yeah. I was just going to say, I think one of the things that we need to do is we're all here for the same reason, and that is to make sure every single child in our community thrives, every single one of them. We should not be feeling like we're competing. There's enough kids to be in every private care setting, Head Start setting, pre-K classrooms. We have enough kids, and they're not all attending. And so what we need to do is break down the silos and competition and figure out a way to make sure that all the private care, because every child is different and every parent wants what they want for their child, and that is something that we respect. We have incredible pre-K classrooms. I love going in our pre-K classrooms. They're amazing. But I would love coming in to see yours because they're amazing too, I'm sure. And so I think we need to not be in this, at some point we got to figure out, instead of competition, how do we fund all and make sure that our families really do have choice of where they go. And that's what we're about. We're about lifting everyone up so that everybody thrives and our community thrives as well.
Thank you. I was going to say something very similar to that, but I just want to add that I feel like coming from the private sector, having the private child care center, it's important that we all just connect ourselves, and I would love to connect with everyone in the back so we can talk about getting a resolution to, like she said, how can we get the funding spread to everyone. So I definitely would love to hear your thoughts. You've been in the business 20 plus years. I'm excited to kind of chat with you about that. So let's see where we can take this further, because we are also, in need of funding. That's been a big topic tonight. And I just feel like it really, from the private sector, we definitely need to connect and pull together ourselves.
And I want to add, this is Vivian Stearns. I want to add to the child care partners.
About a couple years ago, I did put in an expansion grant because I definitely believe in children and parents having options. And so unfortunately, I didn't get that expansion to add family child care homes. And if you all remember, some of you, I even probably got on a Zoom call with you. But if you don't remember, I am now, and I just talked to CCNR a couple of weeks ago about some things that I have in my mind to do with my grant now. And that was including family child care homes, because I definitely believe that my parents should have an option. So that is something that I am committed to working with family child care homes. And again, we're supposed to probably talk soon, because I told them in April I have something up my sleeve that I wanted to do with family child care homes. So there is something up my sleeve, and I am committed to working with family child care homes.
Thank you. I think we have time for 2 questions, brief questions before we close this session. So at this time, our next question, yes.
Hi, I'm Cheryl Smith. I'm a center director for a child care facility off of Union Cross. My question to you all, and with the NC Pre-K, I advocate for NC Pre-K even though I have a corporate child care facility. 95% of my families are private, but I want to engage in getting DSS families in, but over the market rate sometimes hinders them for do that. We are excessively high out there in the Kernersville area. But for NC Pre-K, my question is to you all is, how do we break that stigma? Because a lot of my families are private paying, but they do have children that their birthdays are after the cutoff. So we have those September through Decembers, and they want to apply, but the first thing they say is, my income is too high. But how do we break the stigma that they still can apply and maybe get into some of the NC Pre-K classrooms?
Well, I think NC Pre-K is actually distributed a little different way. Part of it goes to the private child care, part of it goes to the public schools, and then a part of it goes to Family Services Head Start. So we actually split it 3 ways amongst the 3 different organizations. And the way we do those rates is actually the private child care gets a higher rate because it costs more for you to operate. You have additional overhead costs. So we actually split that, and the school district actually gets the lower rate compared to the other 2 partners when we divvy out those funds. But unfortunately, in our particular community, it's really important to be a part of that committee of NC Pre-K, because that committee is made up of actual volunteers who actually determine how they're distributed. And we do a pretty good job in advertising the NC Pre-K program. You should see commercials, you should see the information out on bulletin boards and so forth. I really strongly encourage you to get involved and engage in the NC Pre-K committee, because that will tell you how the funds actually get distributed to the centers. But it's not as much of an income base as much as it is you being a person who's selected based off of being involved in that committee, and also having someone go to your site to actually select your site.
Well, not so much my site.
Okay.
Just getting my parents to get into the NC program. Okay. Because just this week I've had 3 or 4 families that didn't even know about NC Pre-K, and I had to give them knowledge about it. Okay. Because they don't know. So the thing is, the first thing they say is, oh, my income is too high, I can't apply. And I'm like, no, just continue to apply. You never know, because there's different criterias that can meet where you can go. So last year I had about 4 or 5 to leave my center to go to an elementary school, and they have 2 parent incomes that is very expensive or very high. So it's not always about, oh, the income is too high. They look at all criteria. So how can I get my parents that want to go to NC Pre-K into the NC Pre-K programs?
Okay. So maybe we need to do a better job on how we do some of our marketing, and that's with the school district as well as Family Services and Smart Start. So we can maybe work on a better communication plan to make sure it's getting into those specific communities if those parents aren't understanding our message. So we'll work on that. I appreciate that question. Thank you.
Hi, I have a question. I know that the strategic initiative of the region to focus on the workforce, how early can we start training children to know how to navigate what they want to be when they grow up? When I was little, I was told you can be anything you want, and that's true, and I really believe that we should empower children in that way too. But how do we prepare them for the realities of what the world looks like, and at what age is it appropriate?
So I will say that I'll start if anybody wants to join in, but we have adopted a portrait of a graduate, which honestly, it includes the durable skills that students are going to need for the future, and that is for life, the future. And so that starts in pre-kindergarten. I mean, that starts to developing those skills, and the skills are durable skills that you need for the workforce and beyond. I mean, it's basically just some of them are critical thinking and creativity and collaboration and empathy, learner's mindset, personal responsibility. I think I got all of them. I think I'm missing one. Adaptability. Adaptability, we got it, we got them all. And so those skills start to be taught early on. I'm not saying that early on you should know when you're this big or at 5 years old what you're gonna do, but you should be developing the skills that whatever those choices are that you want to access, that you're developing those skills. There is one of the most important skills, we look at the, is it 10? The top 10 skills that employers are looking for in 2025, and it'll keep growing with AI and all the technologies. And so trying to get our kids ready for that, the future is really important. When do they start getting access to, oh, I might be interested in that? I mean, really, they get exposure in elementary school. We have kids taking field trips. We have students, so do all of you probably take kids on field trips to different places. When we start to really get into some specific classes that might start interest kids and do like interest inventories for careers, that starts for us in about middle school. But there's tons of exposure with career days and so many things at the elementary level. So kids already start saying when they're little, I want to be this when I grow up, I want to be this. The thing is, we want them to explore all endless possibilities. So rather than say, you need to focus on this when you're 5, we're trying to say, we need to get you these skills that so no matter what it is, develop these skills, you're going to be successful in your future. So I hope that answered your question. Okay, thank you.
We want to thank all of our panelists who have come on this evening. Let's give them another round of applause for all of their hard work and participation. Give yourselves a round of applause for showing up and participating with questions. I encourage each and every one of you to connect with our panelists, the services that are provided, and your services as well, so that any concern, questions, assistance in navigating through the processes and the systems, you are able to do so. We want to work together. We want to collaborate. They have committed to do that between themselves. That is important that it is done as well with the community. So thank you all for coming. We appreciate you again. Dr. Miller, we thank you for you and your church for allowing us to come here and to have this session. Thank you to the Smart Start staff as well. Thank you, everyone. Good night.
Thank you for hosting us.
You're welcome.